but traded it all if I gave it.
So welcome back. I am excited because I love the name of this practice. Right now I have with me, and I want to say it right, it's Jonae Hush.
Yes, ma'am.
And she's a nurse practitioner with Pineapple Health. I am so excited about having you on because I couldn't. Why did you call it Pineapple Health is the first thing I want to know.
I think that's a question that everybody actually asks.
Sure, I'm sure.
It was Dr. Kevin Chan who owns the practice. It was his idea, and in short, he said if a computer company could name their computer after a fruit, so could he.
Oh,
so
that's
what
awesome.
he'll tell you. But the other thing is that it actually means in his in Chinese, pear of phoenix, so fruit of phoenix. And what he really is passionate about is his practice actually bearing fruit on the rest of the community around us and in Phoenix.
Now, where are you located?
We're actually located in Ahwatukee, Arizona.
Okay, so you're right here in Ahwatukee. And what do you all specialize in a certain area?
We are a family practice, so we offer complete medical care and wellness care. However, we do specialize in hormone therapy and hormone optimization. We use a lot of different services in addition to that, which is very fun to be part of as a nurse practitioner of 10 years. You know, it's nice to be in a place that we can offer so many services right in-house so that we can be comprehensive for patients and provide the best care.
Well, talking about hormones, I mean, that's big. I mean, right, especially to our listeners, because most of them are a little bit older. They're those baby boomers out there. And let's talk a little bit about hormones and what you would obviously do a workup for them. Right now, we're going to offer them a free consultation, which is $150 value. In terms of it, how would somebody even know whether they're having symptoms? What would they be in this and that?
Well, in particular for women that are postmenopausal, most common symptoms typically tend to be hot flushes, night sweats, insomnia, sometimes lower mood, low libido. Men tend to see more fatigue, low libido, some issues with performance, and so if we're having fatigue symptoms, if we're having any emotional symptoms, then we really do encourage us to look at those hormones comprehensively to see where the patient is at.
Now, bioidentical hormones is something that you actually specialize in, right?
Yes.
And so let's talk a little bit about those, what they are, because, we've heard a lot about them, but we really don't know if they really are or not. Go ahead.
Right. So bioidentical hormones are actually identical to our own body's natural molecular structure. So if you took the bioidentical hormone and our own hormone underneath a microscope, they look identical. Mm-hmm. And so they act identically in our system as well. So they're a lot safer for us. Synthetic hormones are a different molecular structure. You can tell the difference. They act differently in our system and are metabolized differently. So we do tend to offer the bioidentical because of the safety.
Okay, so they're safe. And what are the different ones that you use? I mean, there's different, I think they have the little pellets that they can use. What are some of the ones that you use?
In particular, we do the pelleting at the office, which is the safest method. It's been around since 1939. It's got the largest amount of data to prove its safety. But we also can compound bioidentical creams, troches, and patches.
Now, your office is located in Ahwatukee. Their phone number, it's 480-961-2366. And you can also check them out on their website. I know you have a few of them, but I'm going to go ahead and just give this one because it's easy. It's pineapplehealth.org. And again, we're going to open up the lines to the audience for everyone to get entered in to win a free consultation. It's $150 value, free to you or someone that you know. If you're dealing with some symptoms that you're just not feeling right, it's a great idea. Just have the workup done. They do specialize in this. And we can call in here and get entered in to win this. 602-277-5369. And toll free, it's 1-866-536-1100. Okay, so hormone problems are not just directed to women only, are they?
They absolutely are not. Yeah.
Okay, so for men, you say they have a low libido. You see men, you guys out there think that it's only the women that get a little messed up, but it's not true. It happens to you guys as well. So when they come in, is it a different type of a procedure? Do they also use the same things?
They do use the same things for men to optimize their testosterone. The pellet therapy really is superior at not only achieving optimal levels, but sustaining those optimal levels for at least 6 months, and then they're pelleted usually twice a year. Women, we pellet typically anywhere between every 3 and 4 months, and that's just because we're dealing with a little bit more than just testosterone. We're dealing with our estrogen levels.
How long does it take for the effects on those when you put a pellet in?
Yeah.
And does it hurt to put them in?
Well, what we do with the procedure is we make a tiny incision in the bottom, in your bottom, and for a few days afterwards, it is sore. The procedure itself is not painful. We do use lidocaine for numbing, and so that's really the most painful part is the numbing part, but that lasts literally seconds. And so when we put these pellets in, everybody's a little bit different as far as how they respond. I've had women call back in 2 days, can I really feel this great in 2 days? Can it really be? And I've had women come in with their 6-week follow-up blood work and say, I really haven't felt it yet. Was it coming? So I've been doing this for over a year, and I've really actually seen, a wide variety. But most of the time, within that 3 to 6 month period, for men and women alike, we are seeing symptom improvement.
Well, they're located in Ahwatukee. I know it's Cinco de Mayo, you guys out there that are having fun getting ready to go out and stuff like that. But this that you're listening to, it's informational. And they're offering a free consultation. This is a $150 value free to you. What is the workup that they get? At the consultation, what can they see when they get there? What can they see happen in the office? What do they go through?
Well, with the consultation, what we'll do is you'll sit down with one of the providers and go through symptom history, past medical history. We want to make sure it's safe to do the hormone therapy too. So some past medical history can be contraindicated for some of the hormone therapies. However, if patients qualify as far as symptoms, then what we're doing is we're doing a full hormone panel. We look at white blood cell counts. We look at red blood cell counts. We want to monitor those. For men, we particularly are looking at their prostate cancer screens to make sure they are a good candidate, that there's nothing underlying. And then once we get the blood work back and we identify that they're a candidate, what we do is we take their height, their weight, their symptoms, all of their levels, and we use a national dosing site calculator. So it's not guesswork. It is really pertaining to that individual and what they need.
And everyone's different?
Everyone is absolutely different.
And then once they get that approval for that, and that they can have this, again, that's done right in the office.
Yes.
And it's pretty simple procedure, and you can actually feel better within less than 2 days, practically.
Some people do.
So we have our lines open here, and our number here is 602-277-5369. Toll free, it's 1-866-536-1100, and everyone is getting entered in to win. It's a consultation. It's an hour consult. How long is a consultation?
Usually it's about 30 minutes.
Okay. So it's a 30-minute consultation, and it's $150 value, free to you. So give us a call here at 602-277-5369, and toll free it's 1-866-536-1100. You could check them out on their website, which is pineapplehealth.org, and you can also call them direct. Their number is 480-961-2366. Well, before we go to a break, because I think that, we've been talking a lot about these different things. What is the difference between then the synthetic hormone and a bioidentical hormone?
A little bit, just talking about the molecular structure as we did before, there is a difference between the way they act in our body. The bioidentical hormones actually promote health, and synthetic hormones can actually cause a health decline. And so we're actually in it for health optimization. We're in it for the bioidenticals actually help prevent cardiovascular disease, Alzheimer's. They help prevent osteoporosis. And
why don't more people do it that way? Why don't we all just do it that way? Why do we go into any other route?
it's insurance based. So some people want to get what the insurance will cover, which insurance will cover your synthetics.
Okay.
Insurance doesn't recognize the approval of bioidentical hormones.
But it's better for you.
Better for you. So is weight management, but insurances sometimes don't cover that either.
Right. Well, I think it's a great way to find out whether or not that, they can help you, make you feel a little bit better. And there's so many people out there that are suffering for no reason. And they're going to do a free 30-minute consultation for everyone out there that calls in. You get entered in to win. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out on their website. They specialize in this. It is pineapplehealth.org. And again, you can call them direct. Their phone number is 480-961-2366. We're going to go to a break, and when we come back, we're going to talk further about some of the different things that you can do in the office for them. Again, check them out on their website. It is pineapplehealth.org, or call them direct. That phone number is 480-961-2366, or call in here, whether it's you or someone that you know. Make them feel better at 602-277-5369. Toll free, it's 1-866-536-1100. It's pineapplehealth.org.
Traded it all.
Welcome back. We're talking with Jonay Hush,
Yes.
Push, if I say it correctly, and she is with Pineapple Health. And we're talking a little bit. We were talking about bioidentical hormones, but there's so many other things that you also offer there at the practice. And one of them, this is really different, and I got to ask you what it is. We're just to try to get to both things here. One is brain paint. What is that?
Brain paint is actually a non-medicinal way to treat anxiety, depression, insomnia, PTSD, ADD, and it really, we focus on that so that we don't have to have patients go on medicines that have, really actually very serious side effects. It is actually imagery and biofeedback. There's a lot more information on brainpaint.com to talk about more the brain analogy with it. There's, each session is about 30 minutes, and the first session is an hour and a half, where we actually do a comprehensive evaluation of what the symptoms are, what we're trying to achieve. Some people get better within 7 sessions. It can take 30 sessions. It just kind of depends on each individual and what their needs are.
And what is it? How do you do that? It's biofeedback. So what is that? How does that work?
It's imagery with a computer. So what happens is the individual is left with a computer, and based on what their treatment needs, there's different places of the brain that we want to have affected. And so with that brain paint, we can actually leave the patient with these imageries, and the imagery actually is retraining the brain how to respond.
Wow. Hey, we've got our lines open here for everyone to get entered in to win a free 30-minute consultation. It's $150 value, free to you. If you know someone who's depressed, and so many people are out there, do you also do this on children as well? I mean, not too young, but I'm just saying because the teens are depressed.
It works great on children.
Okay, so great for children too. They are located in Ahwatukee, and their phone number direct, it's 480-961-2366. We've got our lines open here for people to get entered in to win a free consultation. It's a 30-minute consultation. It's $150 value, free to you. This is something that if it's not you, if you know somebody who is suffering, they shouldn't. And I don't like the medications. I hate them, and I wish that people would look at something like this and go with something a little different before they just jump into getting these pills, because the pills are just masking everything. It's not really getting to the root of the cause, and this will. You could check this out, what she's talking about here at brainpaint.com. It's all under the Pineapple Health office. I'm trying to come up with it, but the practice there. But you can check it out, what they do there at brainpaint.com, or call them direct. The number is 480-961-2366, or call in here and get entered in to win a free consultation and find out what they can do for you or someone that you know. It's $150 value, free to you. 602-277-5369. Toll free, it's 1-866-536-1100. You also do cardiovascular help there, and let's talk a little bit about that too.
Yes, we offer our level 1 diagnostics, which is advanced cardiovascular testing to look and see what the vessel health is, so that we can actually start prevention before those symptoms are realized by the patient.
My brother just ended up in the hospital 2 days ago, and I only have one person left in my family, and that's him. And he ended up having 3 stents in his heart. Mm-hmm. And if he would have known and done something like this in advance, It's all about doing things in advance.
Yeah.
He wouldn't have had to have this happen, and it was terrible. So this is very important. Again, and I said that for a reason because you happen to mention it, and people, they relate to me, you know. And if you're listening, please get these things checked. What do you do there at the office for that?
For the level 1, we're doing advanced carotid checks. So we don't just look at velocity and flow. We actually look at the lining of the vessel. And if there's inflammation there and there's soft plaque there, you're at risk for plaque rupture, which means that you're at risk for heart attack and stroke because that plaque rupture equals blood clot. And so if we can identify that inflammation, and that's a large part of what we do in the office is identify these factors that, are promoting inflammation in our system and try and work naturally to reduce that inflammation. So when we identify through these studies, through the level 1, that there are risks, then we can actually act naturally to be preventative and get that inflammation down through a lot of different natural supplements, omega-3 fatty acids, vitamin D, K2, L-citrulline, magnesium. There's so many things that we can do preventatively to protect our health.
You know, it's really important, and I know that a lot of us don't like to think about it, and we think we are invincible. We used to say that about the teens. They think they're, well, so do we, because we don't think it's going to happen. We don't even want to think about it. And the fact is that it doesn't. You could make this on your own. You don't have to. Correct? Am I correct? It's hereditary.
Some of it is, and we can identify that too through our comprehensive lab tests that we do.
And there are things that you can do, obviously, that are natural, and then they can help you with all of that. I know you mentioned some things, and I think they're awesome. Some of them are quite different that you may not know about. They do a free consultation. It's a 30-minute consultation. Obviously, it's a comprehensive consultation. It's $150 value, free to you or anyone you know. You can call in here. I'm going to let you call for the next 10 minutes and get entered in to win this. And then the number here is 602-277-5369. Toll free, it's 1-866-536-1100. You could check them out on their website. It's pineapplehealth.org, or you can also call them direct. Their phone number, it's 480-961-2366. Of all of these things, when somebody comes in and, well, let me ask you this. On this one here, do you have a website that directs them to some of the different things that they can look at that you can offer for them to do naturally?
They should be able to find the information on the pineapplehealth.org. We have a lot of the services that we offer, and they can actually go on there and look at all the services that we provide. Until we actually have the results, we don't know exactly what to offer them and what will be preventative. But in general, omega-3 fatty acids, unless you're allergic to fish, are not bad for anybody.
Right. We just don't like the way they taste, Doc.
But you've got a good one. If you have a good supplement, then usually you won't have that burpy fish taste. You won't have that indigestion that some of the non-pure,
Do you have that all in your office as well? Do you offer all of that to them too? Okay. And then can you compound there too?
We don't compound, but we do work with a number of compound pharmacies around us.
And so in terms of this, when somebody listens to this about cardio, when should they start really checking?
Typically, if there's any indication of high blood pressure, if there's any history of high cholesterol, if there's any family history of cardiovascular disease, we need to start checking early. We start recommending it even in our late 30s, early 40s, especially when we're doing their wellness exams and we identify any risks.
Now, again, they're located in Ahwatukee. It's pineapplehealth.org, and we've got our lines open here for everyone to get entered in to win. It's a free 30-minute comprehensive consultation. It's $150 value, free to you or someone that you know. Whether it's bioidentical hormones that you want to learn about, find out how you can get better that way. And most people, I think most people have a hormonal imbalance. Even these kids do.
That's true. I mean, women actually start losing their testosterone at around age 30. And so we can actually lose 50% of our testosterone production in our early 30s. And by the time we're 40, we have even less than that. And the problem...
And when you're 50, you can forget it.
Yeah. Well, the problem is that, traditionally we look at lab values and there's reference ranges. And as long as people fit in that reference range, providers say, oh, you're okay. You're in that reference range. But we know that that reference range is an optimal
And
range.
again, tell them about the brain paint again, too.
About the brain paint. The brain paint is when we identify someone having a little bit of trouble with anxiety, depression, even if it is hormone related, adding those hormones in with brain paint gives phenomenal results.
You could check that out at brainpaint.com. And again, if it's bioidentical hormones, if you find that you need something like that, if you're depressed, if you know someone who's depressed, and again, she says it's great for children, and our kids are all crying out for help. You could call them direct. They do this consultation. It is 480-961-2366. We've got everyone entered in to win this $150 value free comprehensive. It's a 30-minute comprehensive consultation. It's $150 value free to you or anyone you know. Again, our number here is 602-277-5369. Toll free, it's 1-866-536-1100. What would be your final words for today?
Get checked and don't take reference range for an answer.
I'll tell you something, guys. I love the name of the practice. It's pineapplehealth.com. Also, you could check out all of this information too at brainpaint.com. The information about what they can do for that, the biofeedback stuff. That's awesome. Again, also for any of the cardiology information, you can see everything that they offer at pineapplehealth.org. You can also keep on calling here at 602-277-5369. Toll free, it's 1-866-536-1100. Get entered in to win that $150 value free comprehensive consultation right here at 602-277-5369. It's pineapplehealth.org.